Today, we're going to talk about the three things that shape your child's airway health. Part of the reason why the path isn't really clear is because it sort of depends on getting deeper into the root cause for what's going on for your child and what symptoms they're presenting with. So let's dive into this. I've drawn out this sort of little core piece of a lot of the possible areas that we would think of as sort of a root cause, perhaps, when it comes to what we call airway health concerns. Sometimes that's mouth breathing. Sometimes that maybe we're seeing the muscles aren't exactly doing what they need to do. Other times we're just noticing, hey, there's some crowded teeth. I heard that wasn't good. Um, Restricted airway might be suspected when we're dealing with really poor sleep and nerve signal alterations, maybe in terms of kind of motor skills, development, speech, different things like this that we might be looking at to try and figure out what is going on. Is there a deeper kind of airway involvement here? So despite the fact that this is sort of this core presentation, the reality is that there's a lot of root causes that can even lead us to this core part. And some of them are root causes and some of them are symptoms. So that kind of makes it that much more confusing when we're trying to figure out what's going on and how to navigate which direction to go in terms of getting support. So the the situation, I kind of just threw these in the background because really you can have enlarged tonsils and adenoids that are maybe going to be driving the habit of mouth breathing, or maybe it's a tethered oral tissue that's driving this mouth breathing. And that's not to say that that's not also going to be tied into this improper muscle function, which then ties into improper jaw growth and all of that. So that's why there is this sort of cyclical nature amongst all of these. But really, we can look at hormone alterations, we can look at the microbiome, picky eating, strain, physical trauma. Sometimes that's just during birth. So there's a lot of directions that this can go in terms of trying to get to the foundation of what's really at play here. So that's why I created my own explanation through the three pillars of airway health. These are my three pillars. I've created them as form, flow, and foundation. So form is going to fall into more of the shape and structure of the face and body. We're going to dive into each of these categories in a moment here to give you a more extended version and explanation of what I mean. Flow is going to be more of the rhythm and pattern and motion throughout the body. And then foundation, this is more of what's going on in sort of the biology, the cellular level of our body, inside our body and brain. So when we go to that form, that first pillar, some of these things can be happening in the nose, in the mouth, in the pharynx, and in our bones. So for example, when we're looking in the nose, we might have nostrils. Nostrils have more technical definitions of kind of the way that the muscles fit around the opening of the nostrils. And so we have something called the nasal valve. And so for some people, just the fact that the nose is a little more open or a little more closed can make a difference as to our airflow and our airway health. Septum deviation, we have this bone that runs through the middle of our nose, and sometimes that gets crooked for a variety of reasons. It could be from physical trauma, it could be from a high developing palate, and that's going to affect the way that the air is getting through the nose as well. There are other little areas inside the bone that are inside the nose, different bones inside the nose, and there can be soft tissue enlargement in there. There can be bone enlargement in there, other things, and even just things that aren't supposed to be there. If there's some sort of cyst or otherwise in the sinuses in the nose, that can lead to making it harder to breathe. Then going down a level into the mouth, we might have issues with the tissues. So tethered oral tissues, something like lip ties, cheek ties, tongue ties, problems where the fascia is restricted. And by virtue, even though this is a structurally based issue, it's going to have a lot of functional implications or side effects into how we eat and otherwise. Dental malocclusions, so again, just crowded teeth. The teeth aren't in the position where they should be, other things of that nature. And sometimes congenital syndrome. Sometimes there are genetic components and just birth development situations that are going to lead to different restrictions structurally in this form category. Within sort of the back of the throat, we have things like the tonsils and the adenoids that can be enlarged. Again, this is going to be a structural issue if it's presenting as enlarged, but there could be a background reason, maybe something like mouth breathing that was more of a functional issue has now led to inflammation of these tissues, and now we have this structural issue at play. Size and collapsibility of the soft tissues. So the way that it's developing, are we able to breathe through a garden hose, or are we stuck breathing through a little coffee stir? There's a sort of tubing that is our airway that runs through the back of our throat, going from our nose down to our lungs. And if it's not developing, if the face isn't developing forward enough, then that airway space is limited. Bones is another area. Obviously, the jaw bones is part of that, and looking at how that can influence poor tooth relationships or relationships from the upper jawbone to the lower jawbone. Cranial strains within the whole skeleton, the whole skull, can be at play here. Again, that might be something that happened during birth, is some compression. When we see babies with flat spots and things like that, sometimes that can be related to these kind of pressures that are being applied to the very delicate relationship of the jaw bones at that point. And that can have effects on kind of how our nerves are able to send signals and otherwise. Vaulted hard palate, I talked about, that could result in kind of less nasal space if it's kind of crunching up into the nose, because the same bone, the upper jawbone, the maxilla, it's the roof of the mouth, but it's also the floor of the nose. And then spinal posture. This isn't going to be only our posture of the upper jawbone and lower jawbone. This really is related to the way that the bones are, our spine, and otherwise, really, there are ripple effects all throughout the body in terms of how we position ourselves. And sometimes having a more hunched forward posture can be a breathing adaptation that's going to allow us to breathe better, but then that's going to structurally get stuck in our habitual way of positioning ourselves, affecting our posture, which ultimately may make it harder to breathe. So it can be very confusing and cyclical, but these are some examples of some of the things that I would think about in that first pillar, that form pillar. When it comes to our second pillar, flow, these are going to be, again, things that are relating to movement in the body, and some of the more functional movements that we do include breathing, sucking and swallowing, chewing, and then also, like I was just starting to talk about, tone, like posturing of our body is related as well. Motor development is another way that we're really kind of stacking different skills as we develop. And so any one of these areas can have different functional issues that show up. So for example, with breathing, we know that we're meant to be breathing through the nose rather than through the mouth by design. Our nose has a lot of benefits to filter the air that we're breathing, to humidify the air that we're breathing. So there are a lot of benefits, but also that these functions are affecting how our nervous system is sending signals, how our body is going to position itself and grow. You've probably heard by now that if we're habitually breathing with our mouth open, that is going to change the growth pattern of how our face grows. Sucking and swallowing, this is like the earliest practice we have for jaw growth and development. The way that our body is designed during breastfeeding is the first point of kind of stimulation to the upper jawbone and the lower jawbone, the way that the muscles interact to start signaling the body to grow. We obviously have to adapt sometimes and rely on bottle feeding methods and otherwise, but knowing that the actual mechanism and the muscles used are going to change when we change the feeding method. But not only it's not only about growth, the way that we swallow and the way that we're doing these functions can affect how our ears drain. It can make us more predisposed to reflux disease. And this goes closely with chewing as well, because if we're swallowing a lot of air, we're not chewing our food correctly, it can cause a lot of digestive issues. For some, picky eating, if we have airway issues, we're not going to be as comfortable spending time chewing more food that's difficult to chew. If our default airway is the mouth instead of the nose, it's not going to feel safe to have food spending time in the place that we breathe. So we might have more picky eating that can affect our nutrition levels and different things like this. And again, that ongoing chewing is signaling growth stimulation. Throughout the body, I talked a little bit about forward head posture, and that's going to put different pressures on the neck. Sometimes the way that we're involved in the chewing and all of the other things I just mentioned are going to shift and cause issues in the development of our jaw joint, our TMJ. Like I was saying earlier, if we're not positioned correctly, if we're hunched over or otherwise, it's going to change the mechanics of how we actually breathe, how we are able to eat and digest. There's a lot that sort of goes into all of this. And lastly, that motor development cascade that I was talking about, that's something where we're born with these basic functions and we know how to initially feed ourselves, and that's part of over time, it's going to mature. We're going to introduce solid foods. We're going to go through these pathways, not just with our way that we eat, but really the way that we move through the world is going to progress. And if we have areas that aren't maturing, then that's going to have effects on some of these other motor development skills as well. That foundational level, really, there's so much where this kind of fits into our more common perception of like functional medicine. We talked about nutrients already a little bit in terms of if you're not getting the right food breakdown, you're not always getting the right nutrients. But if you're not getting the right minerals to help the jawbone have the building blocks it needs to grow, then that's going to make it difficult for the jawbone to grow in the way that it should. If we're relying more on mouth breathing versus nose breathing, again, we're going to be kind of sending stress signals in our body. It's going to predispose us to more respiratory illness and inflammation, whether it is just the presence of poor oxygen, which is a really big deal on its own, or if it's interrupting our sleep, then that introduces a whole nother layer of health implications here. And so if we're not getting the right sleep because we're not breathing well, it's going to throw off our growth hormone. It's going to throw off hormones like antidiuretic hormone that helps us not have to pee in the middle of the night. So bedwetting in children or adults who just need to get up and go to the bathroom in the middle of the night. This can be a thing at all ages. Our stress levels in our body and different effects can play out in anxiety, depression, and things like this over time if we're not breathing well, if we're not sleeping well. Again, like this is a pillar. This is not only going to be the outputs of poor oxygen and poor sleep. This is an input. If we don't have a gut that has the right foundation for health, then we're going to have a hard time getting that sleep, getting our health to be the way that it needs to be. Because in my opinion, there's often all three of these pillars are going to be in play. So that's why there's really sort of this sequence of events that you can see. It's really hard to always know where the originating factor is, but we have to jump in and sort of look at how we can jump in when we notice that muscle function's off, that growth and development's off, that breathing or sleep is off, or even that these other signs of overall health, for example, maybe we're seeing eczema or something like that, and we're not getting clued into the fact that that might be a gut issue. These can really start to be cyclical in nature and hard to unpack. But if we jump in and kind of revisit that we've got these three pillars, that can sometimes help us kind of get sorted and figure out, okay, maybe we did go to an ENT first. So maybe that helps us clear some of the major questions or concerns of if something's an issue from form. And, it's not only going to be clearance from an ENT, we need an airway focused dentist to tell us if the jaws are developing correctly. It's ruling out the presence of a tongue tie, things of that nature. But maybe that helps us know, okay, maybe we don't have a form issue. Maybe we have more of a flow issue here. And so if there's more of a flow issue, then maybe myofunctional therapy is the perfect place to get started, finding a speech therapist or hygienist that can offer some myofunctional therapy and help us tackle some of these issues that were in that flow category. When it comes to the foundation category, I think that that's going to be an area that, again, we're going to rely on more of the conventional sort of functional medicine doctors or integrative health providers to help us if we need to do any sort of microbiome testing, if we need to check in on vitamin D levels, for example. So there's different things that we can look at through all of these pillars. And again, I don't present these in the idea of like it always has to be all three of these things, although commonly there's going to be overlap of all of these situations because our body isn't really fragmented in these pillars. Our body is one complex system, but we also have to kind of break it down and make it so that we have an ease of somewhere to start. And so that's how I like to go about this sometimes is figuring out, okay, what's our symptom that we're most worried about right now? And where can we go for answers? Again, sometimes we're going to have to move from pillar to pillar to pillar until we've completely caught up to getting things on track, but we have to pick somewhere to start. And so hopefully this helps provide some perspective on why we need that interdisciplinary care team in play. Thank you.